OET speaking test. Role play example for doctors. Episode 1. Post-cardiac arrest management.
You see a 45-year-old patient who suffered a mild anterior acute myocardial infarction 2 weeks ago. Recovery was uncomplicated and the patient was discharged from the hospital 4 days ago. He is now concerned about how much physical activity is appropriate during recovery. Here is the task you need to prepare for. In the real exam, you will have 3 minutes to prepare for the conversation. Please pause this video and read through the task carefully.
Good morning. Please take a seat. I understand you've had a recent heart event. How can I help you today?
Morning, doctor. Yes, about 2 weeks ago, I suffered a heart attack. Since then, I've felt weaker, and my energy levels seem to have plummeted. I wanted to discuss how much physical activity I can safely do without risking another incident.
First, I'm sorry to hear about your heart attack, but I'm glad you're here discussing your recovery. It's entirely normal to feel fatigue and weakness after such an event. Typically, it may take 4 to 6 weeks before you begin to feel like yourself again. The road to recovery can be navigated safely with the right guidance. What kinds of activities did you have in mind or used to enjoy?
Before the attack, I would occasionally walk in the park, do a bit of gardening, and swim during the weekends. Now, I'm hesitant and scared that they might be too much for my heart.
Those are all wonderful moderate exercises. Given that you've had an uncomplicated recovery thus far, it would be beneficial for you to reintroduce these activities gradually. Exercise, in fact, has numerous benefits for the heart. It strengthens it, aids in overall well-being, and can even help in managing cholesterol levels. However, the key is moderation and paying attention to your body. Should you ever feel discomfort or uneasiness, it's essential to pause and rest. Have you ever heard of cardiac rehabilitation programs?
No, it's the first time I've come across that term. Could you explain a bit more about it?
Certainly. A cardiac rehabilitation program is a structured initiative tailored for heart patients. It aids in increasing exercise tolerance, providing education on heart health, and offers psychological support. Joining one would mean you're surrounded by professionals who can guide you on ramping up physical activities in the safest manner possible.
That does sound quite reassuring. I've been pondering about my job too. It's an office job, so mostly sedentary. I spend most of my day at a desk and don't move around much. When do you think I could consider going back?
Given the nature of your employment, typically, a 4 to 6 week period post-event is advised. But this isn't just about physical readiness. Emotional well-being is just as crucial. Collaborating with your employer for a smoother transition, perhaps a phased return, or flexibility in hours initially, might be beneficial. How do you feel about your return?
I am apprehensive, to be honest. My primary concern is the recurrence of a heart attack. I want to know what measures I can adopt to mitigate such risks in the future.
Your concerns are shared by many in your situation. Reducing the risk involves a multi-pronged approach. A balanced diet, rich in vegetables, fruits, and whole grains, is foundational. Staying active, as we discussed, will significantly benefit your heart and overall health. It's also crucial to adhere to any prescribed medications and have regular medical checkups. It's a journey, and it's okay to ask for help and support along the way. Your well-being, both physical and mental, is paramount.
I truly appreciate your insights, doctor. The information has been very illuminating. I'll aim to slowly increase my physical activities and definitely explore the rehabilitation program you mentioned.
You have a proactive mindset, which is excellent. Remember, your recovery is a marathon, not a sprint. If you have any questions or anxieties arise, don't hesitate to reach out to us. Your health and peace of mind are our priorities. Take care. How was it? Now, we'll be discussing some key expressions from the conversation that can help you establish rapport, guide your patients, and provide clarity in your consultations. Understanding the context and correct usage of these phrases will enable you to communicate more effectively with your patients. It's entirely normal to feel. This expression is pivotal in validating a patient's feelings or symptoms. It serves two purposes. Firstly, it reassures patients that what they're experiencing isn't unusual. Secondly, it creates a trustful environment where the patient feels understood. For instance, if a patient mentions anxiety after a diagnosis, you might say, "It's entirely normal to feel anxious after receiving such news." Exercise, in fact, has numerous benefits for the heart. This phrase educates the patient and emphasizes the importance of physical activity. It's particularly useful when discussing recovery or prevention strategies for cardiovascular issues. By using "in fact," you're stressing the significance and possibly countering any preconceived misconceptions the patient might hold about exercise and heart health. The key is moderation and paying attention to your body. This statement is vital when providing guidance on activities, especially post-diagnosis or post-surgery. It reminds patients that while activity is essential, it shouldn't be excessive, and they should always be alert to their body's signals. For example, in discussing post-operative exercises, you could mention, "The key is moderation and paying attention to your body. If something feels off, it's essential to rest and consult." Given the nature of your employment, typically a 4 to 6 week period post-event is advised. This phrase offers personalized advice based on the patient's profession. It provides clarity on recovery time, especially after significant health events. By mentioning the nature of your employment, you show the patient you're considering their unique circumstances, making your advice more tailored and relevant. Collaborating with your employer for a smoother transition might be beneficial. Last, but not least, this is a constructive suggestion, especially for patients anxious about returning to work after an illness or procedure. It emphasizes the importance of communication and seeking support in the workplace. It's a way to remind patients that their health is paramount, and that they should actively engage in conversations about their well-being at work. Each of these expressions serves a unique function, from reassuring and educating patients to providing actionable advice. Familiarizing yourself with them and understanding their context will enable more effective, empathetic, and clear patient interactions. Remember, communication is key to establishing trust and ensuring your patient's well-being. If you want to see this script, please visit our website, www.writingly.co.uk.
And if you found this video helpful, give it a thumbs up, share, and don't forget to subscribe for more awesome content.
Until next time, keep practicing and stay confident.
See you in the next video.
Bye-bye.